Come on, this is the favorite day of the month. You get to be in our room with your favorite people across the region that have unity of heart and mind to change the world and transform lives. How can we give up this amazing meeting?
I hope you guys don't mind, but I am fond of the spotlight effect on Microsoft Teams. So I spotlight the folks that are either speaking or should be on your screen. So you should be seeing Tanya, Greg, Michelle, Karen. Please let me know if I left anyone out. And it's just because yeah.
I know I heard you're extremely tech savvy, so that is like really great. I really appreciate it.
Okay.
And let's see, it's about 3 minutes after the hour. How do we feel, team? Are we at a good place to get started?
Sure, absolutely. Happy to jump in. So here we go. Good morning. Happy holidays, everybody. So excited to have you here. Think that we are, we live in the world of, is it a fiscal year? Is it a calendar year? But we're getting ready to end 2022. I think it's been an absolutely incredible year in terms of all of the opportunities and collaboration and amazing things that we've had to share together to help people across this wonderful Riverside County. And we even have some more great updates about initiatives that are going to help to even improve the region more. So you're going to have some exciting updates from our amazing county team. So I want to welcome you all. We are going to dive right in. And we have David with us. David is transitioning to take over Josh's role. David is not new to HWS, and of course, we know Josh is going to stay with HWS in a different role. So I thought, since David, you're going to be handling roll call, why don't you introduce yourself? Tell us a little bit about who you are, why you're excited to be with us, and then jump into roll call.
Of course. My name is David Escobar. Pronouns he, him, his. I am native to Corona. You'll find me in the wild parts of Corona, such as Skyline Trail, where I walk with my golden retriever and occasionally my blue and gold macaw. And a little bit about me: I've been in public service for the over past 8 years. I've seen many of your faces in different capacities, whether that be nonprofits or the Census Bureau and now HWS. I'm just glad to be here and be working with a lot of phenomenal leadership and all of you. That being said, we're going to jump straight into business because true to the work, we need to take roll call, and we know there's a few things to go down here. So I'm going to go ahead and take roll call. If you are the primary or secondary person, please let me know, just in case I see that. But I'll do roll call, and if you could just unmute and confirm you are here, I greatly appreciate it. Okay, so first on the list, we have alternatives to domestic violence. Okay. Brilliant Corners. Okay. Citizen Advocates for Seniors and Homeless Solutions. CityNet. City of Banning.
Yeah, hi. It's Roman.
Okay, thank you. I was like, Bueller. Okay. City of Eastvale.
David is here.
City of Hemet.
Linda Krupa is here.
Thank you, Linda. City of Lake Elsinore. City of Menifee.
Good morning, Anna LeBron.
City of Moreno Valley.
Good morning, Ashley Aparicio.
Thank you. City of Murrieta.
Good morning, Lindsay Sisti here.
Okay. City of Harupa Valley. City of Paris.
Good morning, Sarah here.
City of Riverside.
Michelle Davis, present.
Thank you, Michelle.
Erin Edwards, present.
City of San Jacinto,
Good morning, Robin Gilliland here.
Coachella Valley Association of Governments.
Stephanie Shambo, present.
Thank you, Stephanie. Coachella Valley Rescue Mission. Community Health Association Inland Southern Region.
This is Brianna.
Thank you. Corona Norco Region.
Oh, here, Karen Roper.
Department of Public Social Services.
Good morning,
morning.
Renee Huckstead here.
And this is Linda Salas.
Thank you, Linda. Desert AIDS Project.
Monica Atchison, present.
Thank you. Donna Craig. Oh, sorry, Desert Healthcare District. Faith in Action SGP. Family Promise of Riverside. Foothill AIDS Project. High Expectations Development Corporation.
Nikisha High, present.
Thank you. Inland Empire Harm Reduction. Inland Empire Health Plan.
Good morning, Ben. How did you hear?
Thank you. Jewish Family Services.
Good morning, this is Becky.
Labor of Love. Lake Elsinore Unified School District. Llamas Housing Project. Lighthouse Social Services Center.
Good morning, it's Lorenzo Maya. I'm sitting in for Karen and for Brandon.
Thank you.
Raise my hand.
Lutheran Social Services. Martha's Village and Kitchen.
Linda Barak here.
Thank you.
Can you guys hear me?
Mary,
I'm sorry.
yes, we hear you.
I don't know if you called me or not. I'm sorry. I was on an important phone call that I had to take and I kind of minimized you guys. So I don't know if you
No.
called me or not and got me. Desert Healthcare
No
District.
worries. Desert Dog. Okay.
Thank you.
leave
I
that here.
apologize.
Thank you. No worries. Thank you. Mary Erickson's Community Housing.
Here, Ayako Sumi. Great to be with you all.
Thank you. Mercy House.
Charles Chapman here.
Thank you, Charles. Molina Healthcare.
Robin Maggs is here from Molina Healthcare. Not sure if someone else is on.
Operation Safe House.
Good morning, Sandra Dunn here.
Path of Life Ministries.
Good morning, Leonard Jarman here.
Thank you, Leonard. Queer Works.
Jacob's here.
Thank you, Jacob. Riverside Community College District. Riverside County Sheriff Station, Hot Team.
Good morning, we're here.
Okay, thank you. Riverside University Health System, Behavioral Health.
Good morning, Marcus Cannon.
Thank you, Marcus. Riverside University School District. Oh, sorry, Riverside Unified School District. Romaland School District. Shelter from the Storm.
Good morning, Angelina Co here.
Thank you. Silence Allowed, Inc.
Good morning, Kenisa Jones here.
Thank you. Step up on second. Transgender Health and Wellness Center.
Justin Kennedy here.
Thank you. Turn Behavioral Health Services.
Ramfis Franco present.
Thank you. Inland SoCal United Way.
Hi, everyone. Happy holidays. Danielle is here, as well as my colleague, Rebecca.
Thank you. US Vets.
Good morning. This is Nicole Murray from US Vets. Happy holidays.
Thank you, Nicole. VA Loma Linda Healthcare.
Good morning. This is Oscar.
Thank you, Oscar. And then Valley Restart Shelter. Okay. Anyone we might have missed in the beginning?
I see in the chat box there with the city of Paris.
Hi, was Coachella Valley CVAG accounted for?
Yes, Stephanie is on the call.
Hi, good morning. I needed to check in for Llamas Housing Project. This is Sonia Llamas. I think I didn't unmute myself when you called my name. And then also for Valley Restart as well, homeless shelter in Hemet.
Okay. Thank you so much.
Hey, you're welcome.
Okay.
Do we have a quorum?
We do have a quorum.
Perfect. All right.
All right. Sorry, Michelle, give me 1 second. I'm about to mute all one more time. Okay.
All right, David, if we want to pull up the, let's move to the next agenda item, 1.2 and 1.3. So for 1.2, we do not have any new members at this time, but as we're getting ready to jump into the new year, I highly encourage you all to continue to reach out to important community stakeholders to become members of the Continuum of Care. That's a super important goal for all of us. The bigger we are, the more diverse we are, the better we are. So just want to encourage you to that end. As far as new voting members, would like to welcome Silence Aloud, Kanisha Jones, and I hope I say this right. Is it Kanayo?
Yes, it's Kinisa and Kanayo.
Thank you so much.
Thank you.
And then Lamas Housing Project, Sonia Lamas and Carolina Ayala. I want to welcome you all as new voting members. Yay! Okay, let's go ahead and move to the consent calendar. So we have 3 consent items on agenda. One is the November 16th, 2022 Continuum of Care minutes. Also, the standard resolution to allow us to continue teleconferencing per the Brown Act requirements. And then our Continuum of Care calendar. And I don't know if you want to pull it up, David, and if Tanya, were you the one that was going to say something about it? Or because I know we're not quite finalized with all the meeting dates. Did you want to say something?
You did. Thank you so much, Karen. Good morning once again to everyone. We just wanted to let you guys know that we have finalized the meeting dates for all except these meetings. And the reason for that is we did identify a few conflicts with our current meeting dates. There are several of you who participate in both Riverside and San Bernardino's Continuum of Care meetings, and coincidentally enough, we're hosting our meetings at the same date and time. So in addition, the CVAG Homelessness Committee, which I know a lot of our desert partners also participate in, also falls within the same date. So we are currently working with our internal partners, as well as each of you, to identify a date that works. Our current plan, if you guys will give us your blessing, is to keep our next meeting date in February. If you recall, we kind of go dark in January in regards to meetings, that we're still very much working because of the annual homeless point in time count. So our next time together as a group will be on February 22nd. And our plan is at that meeting to present you with confirmed meeting dates and times that you can review and approve. Thank you. I'm happy to answer any questions that you may have regarding our meeting calendar.
Okay, seeing no questions, I would like to entertain a motion for approval of the items on the consent calendar.
Motion to approve, Jacob. Clearworks.
Jacob, I have a second.
City of Hemet, second.
Thank you. Any objections or abstentions? Hearing none, the item passes. Let's go ahead and move on to agenda item 3, public comments. At this time, members of the public may address the continuum of care to discuss items that are not on agenda. You have up to 3 minutes to present. Is there anybody that would like to submit public comments at this time? Okay. Hearing none, we're going to move on to agenda item number 4. Super excited about this. As your chair, you know, I've wanted to continue to spotlight our superstars that are working so hard across the region to bring transformational change to people's lives. A collaboration between government and nonprofits and other stakeholders. And this month, we have the privilege of having a spotlight on the city of Murrieta, and we have presenting for us today both Brian Ambrose and Lindsay Sisti. So we're going to hand it over to you both. Take it away.
Hi, good morning, everyone. It's just going to be me today. Brian got pulled away with another pressing effort. And I just wanted to give you guys a forewarning. I work out of our community center, and when I just came back here for this meeting, there's a jazzercise class going on. So we might have some background music coming on shortly. So hopefully it won't interfere with my ability to speak on Murrieta. And we have the presentation up. So if we want to go ahead and flip to the next slide, I thought it'd be a good idea just to give an overview of what Murrieta homelessness looks like. I've been a Murrieta resident for a very long time, and before coming to work for the city, I was very unaware of the level of homelessness that does exist in our city. It maybe looks different than other cities in the region, but believe me, every day our teams are out there working, helping, having new people come into town, just every single day. So that top left picture, this is a really big hotspot in our town. It's a tunnel behind one of our synagogues, and this has been a really high priority place for our outreach teams, for our policing teams, our fire departments involved here. So a lot of our homelessness is in tunnels in our city. We have a very substantial tunnel system. If you look at that bottom right-hand picture, this is me and one of our outreach workers in a tunnel last week. It's about a mile-long tunnel that goes under our city, and we got about halfway through there and had an encampment in pitch black with a bunch of 20-something-year-old youth down there that we were able to get into shelter. On the top right-hand corner, another big group of homeless we have are homelessness living in their cars. Versus out on the streets. We run into new individuals in the Walmart parking lot, staying in our parks on a daily basis. And then the bottom left, we get homeless in a lot of our open spaces. We don't tend to get large encampments with multiple tents, multiple people. Primarily, we get single individuals set up in tents or laying out, or sometimes couples. If we want to go to the next slide. So how are we funding homeless services in our city, and what does it look like on a collaboration scale. So we're very fortunate in Marietta that there was a local sales tax measure called Measure T that passed. What that allowed the city to do was, first, they hired me, the homeless service management analyst, which prior to that, the only staff member dedicated to homelessness was my supervisor, Brian Ambrose, and he is a very busy man over all the parks, over at the library, over the senior center. So allowing him to bring somebody in under him to coordinate has really expanded our reach in the community. We work closely with our community policing team. I am with them pretty much every single day. So the Measure T funding allowed us to create a 4-member team, really of very especially trained police officers to work with the homeless. They're very compassionate. They don't want to enforce anything. They want to make sure that we're bridged to them so that we can get people services and get them out of the situation. But we get called, myself and our outreach team, by officers probably 3 or 4 times a day when they're responding to the community complaining about homeless individuals around town. And then we also, through our Measure T funding, were able to adopt the CBAT team, which some of you might be familiar with it, but it's our Community Behavioral Health Assessment team. It's where we pair, again, an officer that's a good fit with a licensed clinical social worker through RUHS Behavioral Health. So if we're working with somebody who, is gravely disabled and meets 5150 criteria, we can reach out to our CBAT office vehicle, and then they can respond and support us in that effort. And if we want to go to the next slide. So in addition to our Measure T funding, we were fortunate enough to get the Emergency Solutions Grant CV2 funding. That is coming to an end shortly here, but the city of Marietta was awarded roughly $1 million. What that allowed the city to do was expand. So we have 2 full-time street outreach workers dedicated solely to Marietta. And again, they're working very closely with our community policing team, with City Hall, and all of our departments. And it's just wonderful to have 2 people dedicated to a small region, and they are very intimately familiar with where people are located, who we have around the city. I would say we know pretty much every single homeless person in our city. And then if somebody new comes in, whether it's the police department letting us know, the library letting us know, the community letting us know, we're able to engage anybody new coming into town or experiencing homelessness pretty much same day for the most part. On top of the 2-man outreach team, I think the biggest blessing is that we are able to fund in partnership with Project Touch in an emergency shelter located within the city. So it's owned by Project Touch. It's a 4-plex, so it's doesn't look like your traditional shelter. It's really 4 2-bedroom apartments, each room having a couple beds in it. So typically we're filled to the brim there. If we have to, we'll squeeze in a few extra people and we can get up to 20 or 21 people into the shelter. And then we also fund through CityNet, who is our case management for the shelter, and also our outreach. We have a full-time case manager to support those 16 individuals and we try to get people transitioned out within 30 days to another program, into their own unit, whatever it takes to not have them return into homelessness. And we've had a ton of success with that. I think just having a place where when we find somebody, they're ready to get help, and we can call Project Touch and get them in same day makes a huge difference in our outcome. So we're trying to get people as quickly as possible out of the street, and we have been able to pretty much stay at functional 0, although recently we've had a pretty big influx and there have been a few times where we have not had shelter beds available. We want to go to the next slide. So I think additional highlights about the partnerships in our city to mention are all of our departments work very closely. Personally, I'm housed with the park rangers. So we have 3 park rangers that cover our 53 parks in Marietta. So either myself or our outreach team, we start at 6 o'clock in the morning. We go and hit all those parks. We get a lot of people sleeping in their cars, people sleeping on the tot lots, people sleeping in the bathrooms. And if park rangers locate anybody in the parks or park maintenance, they know to call our team so we can come out and engage and try to get those people immediately out of their homeless situation, whether it's through diversion, getting them into our shelter, getting them into treatment, whatever the need may be. Again, obviously, we work really closely with our police department. In addition to our regular community policing team, if there's any calls through dispatch and they're not available, our dispatch knows to call me directly. Patrol knows they can call us directly to deploy. So we're constantly collaborating with them. Our fire department and rescue, anytime there's a situation where there's a fire or medical situation happening that's related to somebody who's homeless or in an encampment, they bridge us to them. And if it's a situation where we can intervene and relieve them from their duties, we will. So like last week we had a fire call and it was just one of our regulars having a warming fire. So we were able to engage the client and tell the fire department we're good, you can go. And probably it's probably a big money savings effort as well by having us intervene and not have the fire truck and paramedics and 5 police officers at the scene. We were like, we got it. You can get out of here. We're good. Code enforcement, if we get an RV set up and on a piece of property where they can't be and they don't have hookups, they'll give us a call and we'll obviously go out and engage them and try to get them connected to services. Now our senior center, our youth center, our library, they tend to a lot of times our homeless individuals go and spend time at those locations, and the staff there know to reach out to us, and it's mutual, right? So we have a senior who's homeless. In addition to getting them connected to our CREST team with APS, we can bridge them to our senior center where we know they can get free lunch every day. So it's a very mutual relationship. Additionally, it's one thing we're growing here, but it's a big partnership is our local businesses. So, this morning we got a call from CarMax in Marietta saying they saw some people going in and out of a tunnel. So I went out there with our police department and we did get a gentleman into our shelter down there. So the relationships with our businesses are really big. So instead of calling the police department because there's a transient sleeping in their dumpster, they can reach out to our homeless outreach team and we can get out there and, approach them with services and trying to help them out versus bringing in the enforcement side initially. Lastly, I think one of the things we have that's very useful, if we want to go back to that slide again, is we offer storage with our city. So we have a massive storage container in our public works yard, which has been really important because a lot of times when we're engaging people on the street and, they want to go into treatment, but they don't want to lose their bike and they don't want to, lose any of their other belongings. We have the ability to store those belongings up to 90 days in the container that we have. And a lot of times that makes the difference between somebody not accepting services and then agreeing to go. So we have a really thorough cataloging process, take pictures. I actually manage that myself. If we need to go a little bit more than 90 days, I can be flexible. But that makes a big difference in our day-to-day ability to support our clients. If we want to go to the next slide. So again, living in Marietta, I was unaware of the level of homelessness, and it's much more hidden here, I think, than other areas. But I started here in April, and I really started tracking. Beginning May 1st is when I started tracking. So we've seen 113 different individuals come through Marietta that our teams engaged. I know for some cities you're like 113 people, but that's quite a bit for this area, and that's still 113 people that need help. So of those 113, we have been able to get some type of street exit for 78 of them, and that looks different for everyone. We sort of have a flow of how we determine the most appropriate placement while we're working with the client. So of course we'll do diversion. We have a bus ticket home program. So if we have Joe who has his grandma in San Francisco, and we can connect with grandma, confirm that she can pick him up at the bus stop, give him a place to stay, get him connected with services. We make sure there's no restraining orders. We can get that person on a Greyhound bus out of Temecula and up to San Francisco to go stay with their grandma and figure things out. If diversion isn't an option, we always are going to offer emergency housing. Again, we have our Project Touch shelter if that's at capacity and the person's wanting shelter. Obviously, we work with our other shelters in the county to try to get placement for the individual. Treatment, whether it's getting into a detox bed, going to the sobering center, we utilize that a lot with our partners at our UHS Behavioral Health. If we have somebody that has income and they're just feeling stuck or they have terrible credit, we look into the room and board option. Some of our clients are good for private rental, and we can get them into a room for rent. And frequently, the person's experiencing a medical emergency or is really needing a higher level of care. So again, it's very dependent upon the client, and if we have somebody on the streets who's like not wanting to be there, we will spend all day with one person calling 500 people trying to get them the help that they need. I'm sure a lot of you on this phone call have gotten lots of calls from the city of Marietta because we're pretty stubborn when it comes to that. Of the 113, 25 are no longer in the area or self-resolved. So those are people we maybe engaged a few times and then poof, they're gone, left town or self-resolved back with family or friends, whatever it may be. And right now we have 10, I would say maybe a few more than that, of our long-term engagements, are chronic homeless, not wanting help, or really ambivalent about it, but we know those people very well and see them constantly. So they're kind of the long game for us, but they're on our radar. They know how to get a hold of us. Our police know who they are. Our city hall staff know who they are. So again, I can't stress how collaborative it is in our city, and we're all very invested in helping these individuals. I have some data there just to kind of give you a breakdown of some of the demographics. So primarily we have single white middle-aged men. Like that's what we have in Marietta for the most part. What I have on that blue chart there, it's our unsheltered, the percentage of unsheltered broken down by race, and I compared it to the census data for Marietta. So we have a disproportionate, kind of funny saying disproportionate level of homeless for Caucasian, and then a much more higher disproportionate amount of homelessness for Black, African American, or African. I think our population with the census is about 4% for that category, but for our unsheltered population, it's about 18% are Black, African American, or African. Yep, and we can go to the next slide. All right, and this is our emergency shelter data. I think we're actually close to 300, but since our shelter has been opened, there's been about 300 different individuals going through there. You might say, why are there only 113 people that you did street outreach for, but about 300 for the emergency shelter? That's because a lot of residents are aware of this resource in our community. So, you know, they're reaching out to get into the shelter even before our outreach team is engaging them. So a lot of people, they know in this area, Project Touch is the main shelter provider. And what's great about Project Touch too is once they're in the shelter, if they're working on stabilizing their income, kind of, you know, getting their ID, getting their social security, working on employment, Project Touch has a whole system of transitional housing in our area. I think we have like 300 beds in transitional throughout the region, within the Temecula, Murrieta, Wildemar, Lake Elsinore, this whole area. So if clients do good, can stabilize, we can then transition them over into the transitional housing program with Project Touch. So they're not returning back into homelessness if we haven't secured some other type of housing or placement for them. But again, what's interesting for our shelter, 76% of the people at our shelter have become homeless in the last 2 years. And I would say for our street outreach as well, most of the clients we're engaging, they're not long-term homeless. They're recently homeless in the last couple of years, and primarily men, primarily Caucasian, and 64% are struggling with mental health. 64% are disabled to some capacity, 31 are either fleeing or have been involved in a domestic violence relationship. So that's kind of the demographics of what we're working with in Murrieta. All right, we can go to the next slide. I wish Brian was here. This is his favorite thing to talk about. Brian's baby right now is relaunching the Regional Homeless Alliance so that the 5-city collaborative down here in the region start working more closely, sharing data, sharing resources, having the police departments collaborate. We just were awarded a $500,000 congressional earmark grant from Ken Calvert to really form this Regional Homeless Alliance. And it's between Murrieta, Temecula, Lake Elsinore, Menifee, and Wildemar. Just for everybody's reference on this call, there is a RFP that is about to go out at the beginning of next month for a consultant to get the RHA relaunched. So if anybody's interested in that, it's going to be going up on the City of Murrieta's website in the beginning of January to really formalize this alliance, I guess you would say, so that we're all working more closely together. So we're really looking forward to that partnership, because in this region, if we have somebody who's homeless in Murrieta tomorrow we've never seen, there's a good chance they came from Temecula or Lake Elsinore or Menifee and Wildemar, and then they're going to be back there tomorrow. So by working together, we're going to save efforts, not duplicate efforts, and really have a better idea working together on how we can help those individuals. We'll go to the next slide. And I'm sure you all are like, what the heck? I can't read anything on this slide. I just put this in here for those who do outreach or are trying to navigate the system. This is just a flow chart we kind of over the last 6 months have developed for a framework of how we determine placements, who we can refer out to. So I just would encourage any of you to review this. So as an example, if we have a senior, 60 or older, what do? We call the CREST team, because they have a special outreach team that can support seniors that are homeless. If we have a homeless youth, who do we call? We call Operation Safe House. If we have somebody who's needing to get into treatment, depending on their situation, we can call the CARES line. We have the ARC Detox, Global Detox, the Salvation Army, Teen Challenge. So this is the flow we've developed in Murrieta. Obviously, each client's different, but I think it's a good framework that we work off of. of when we're trying to help somebody and navigate them correctly. So I think that's about all I have. So I guess if anybody has any questions, that's Marietta for you.
Great job. That was fantastic. Does anybody have any questions? That was so rich and had so much information. I encourage you guys to, because the slides are available, to go back and take a deeper dive in all of this great detail in terms of what they're doing. You can see that they are clearly using a systems-oriented approach, and that is what cities need to be doing, and also collaborating with their neighboring cities. You guys get like AAA++. Go to your city, Lindsay, and also to the surrounding cities. We are just so proud of you and here to support you guys in any way that we can.
Yeah, I'm glad I was able to hop on and share what's going on here because I don't think many people know.
Anybody have any questions? Okay, I'm gonna take this time to move the agenda around a bit because I know Greg has to hop off at 11. So I'm going to move new business before agenda item 5 because Greg has something that he needs to present. So Greg, I think you want to present on agenda item 6.2, is that correct?
That's correct.
Okay, take it away.
Thank you, Karen. I appreciate that.
Sure.
All right, and David got the slide up. Thank you, David. So actually very excited to report on this. Many of you heard this at the Board of Governance meeting, but I know we have extra people on board. But the state has instituted a program, the Housing and Homeless Incentive Program through CalAIM, which is formerly known as Medi-Cal, formerly known as Medicaid. With a unique opportunity for substantial investment by health plans into housing and homelessness. So David, if you want to go to the next slide, please. So you can see that for Riverside County, there is going to be approximately a $35 million investment. For those of you on the call that remember just a little 4 or 5 years ago, our total HUD funding was about $9 to $10 million. So you can see, again, this is quite a substantial investment. This is a dual investment by both Inland Empire Health Plan, or what we know as IEHP, and Molina. About 32 million of it is from IEHP because they have the majority of our Medi-Cal clients in Riverside County, and 2 million from Molina. Again, this is a collaborative effort. I know that Ben and from IEHP and Robin from Molina are on the call, and they have been long CoC partners. Ben actually serves on the Board of Governance now. So again, just elevating this great collaborative work to a new level. We've been actually doing a working group for a number of months now over not just the HIP program, but also CalAIM and how we increase our partnership. And so have really escalated those meetings, actually 3 of them this week alone in working groups to determine the funding opportunities and the buckets. I want to really point out that what we've done is we really aligned this with our strategic plan. We were given kind of a 30,000-foot buckets of how the money could be allocated under the guidelines of the state. And Tanya and I worked together with staff to really narrow those down into specific funding opportunities that would enhance our current funding structure, but more importantly, again, align with the strategic plan that many on this call have worked for. It's important to know that there's a very expedited schedule, so that's why we aligned it with a lot of current projects and current funding streams, because the funding stream has to be expended by at least earmarked and allocated by October of next year. So it's a very, very tight timeline, hence our need to establish the buckets. David, if you want to go to the next slide. This is just some information on the HIP program overall. Again, this is a voluntary incentive program. It's not a grant program. So IEHP and Molina have to meet certain metrics. We're working very closely with them to align our HMIS data and future reporting to make sure that they meet those metrics. We're very confident that they will. But once they meet those metrics, the state will allocate those dollars. I do want to emphasize, though, that both IEHP and Molina's leadership have committed to these funds, no matter if they got the money or not. So again, just really enhancing the partnership we have with them. You can see the total incentive for the state is 1.28. Again, we're getting about $35 million here in the county. The funding is available through March 31st, 2024. Again, that's based off the metrics being achieved, but the funding has to be assigned by 2023 October. You can see the funding is facilitate coordination is primarily between the health plans and the continuum of care. I will say Riverside is far ahead of other surrounding counties in this partnership, and so we're really pleased with our efforts on moving this forward. And then the health plans can flow incentive funding to partners who are leading efforts on the ground. Again, that's really how we assign to current funding priorities. David, next slide, please. So there's basically 3 HIP priority areas. The first is partnerships and capacity for support and referral services. The second is infrastructure and coordinate meet member housing needs. And then the third is delivery of services and member engagement. You'll see when I get into the investments in a little bit that a lot of this is focused around the needs for housing. And the main goal of HIP is to actually utilize the health plans to get individuals off the street and out of shelters and into permanent housing with a secure link to healthcare, and that's both physical and behavioral health. As I said, Tanya and I worked with our counterparts, not only within our Housing Workforce Solutions staff, but also with the IHP and Molina teams to develop an investment plan that the plans had to submit to the state. And both of the plans were accepted by the state. Both Molina and IHP plans align together and invest primarily in the same pots of money with just a couple differences between Molina and IHP. As I said, we refined the broad buckets into specific allocations and again aligned with our strategic 5-year plan. Next slide, David. So this is the fun part, and I'm not going to get too far in the weeds. I want to say that also there is some flexibility in how we can allocate some of these fundings if we're not utilizing some in a certain pot of money to reallocate. So again, a lot of flexibility in this program, but primarily these will be the funding amounts for the specific buckets. So the first is system support, and again, this is strengthening capacity not only when not only within the county staff, but more importantly amongst the partners on this call. So how are we looking at technical assistance and other means to coordinate and enhance capacity for our providers? Enhancing CES service integration. We know that we as a county have been doing an amazing job the last couple years in enhancing our HMIS system, as well as coordinating that with CES. So this will help to further that integration, especially as we move into a more integrated service delivery model in our homelessness and housing programs. And then, as you can see, expanding more than account initiatives. So as many of you know, through the point in time count, we utilize this more than account to actually link people to services, and we're really happy that IHP is going to take part in that as well. We actually have added a question to our point in time count this year about linkage to healthcare. If our individuals are linked to healthcare and what health plan, again, this is going to help a lot in the data tracking, but also to the point of making it more than account is if they are not, is making sure that we get them linked to healthcare. The next bucket is community support services. Most of this will go to landlord incentives. As we know, there's a difficulty in us finding transitional and permanent housing units. So by utilizing landlord incentives, which we have already done in this county and has been very successful, hopefully will increase the supply of those type of housing units. And then again, scaling up services for severe mental health and substance use issues. Obviously, we're working very closely with RUHS Behavioral Health. I know Marcus is on the call and has been a key partner in this collaboration as well. The next bucket is CoC collaboration. A lot of this has to do with data sharing, increasing our data utilization, specifically around housing assistance, rental assistance, and prevention. We all know that if we can prevent homelessness, it saves us a lot more money in the long run. Then, of course, capturing housing status of drug Medi-Cal recipients as well. So again, really utilizing our data, cross-sectoring that again with our strategic action plan on those data initiatives. The next bucket, and one of the largest, and there's housing elements in a lot of these different buckets, but in the permanent supportive housing, you're looking at almost $12 million in permanent supportive housing units. We're identifying projects within the county, ideally equitably spread across the county, for housing opportunities. We have already developed a pipeline. I don't believe Mike Walsh is on the call, but Mike Walsh and Juan Garcia from our housing authority team have identified housing projects that that are either already underway or will be underway within 6 months, in order for us to actually provide immediate housing. We're actually going to be doing some internal work too on how we look at our current housing projects that are housing people right now and seeing how those individuals that are being housed are linked to healthcare, specifically both IHP and Molina plans. You'll see the next bucket is equity services support, and this is primarily around our LGBTQ and HIV population. A lot of this money will actually probably be used for housing as well, with a couple of projects that we have in the county. Next slide, please, David. So the next bucket is street medicine support. Many of you know that there's been some really good pilot programs, primarily in the desert, but also over here in the western part of the county on street medicine. We know that a lot of times these are really helpful in outreach and engagement, and highly successful in getting people into programming. And so expanding this cooperation through IEHP and Molina, obviously through a healthcare lens, this is really doable. And also too is looking at it in some of our shelter and navigation centers in our respite and recuperative care facilities as well as we move forward. The next bucket is the HMIS collaboration. And again, this gets around to data as well, but more importantly, it's the expansion of our no wrong door approach, and how are we utilizing our data systems in conjunction with our partners and our health plans to make sure that wherever somebody accesses services, that they're not given a cold shoulder, but a warm handoff to the appropriate partnering agency. The next bucket is community supports. Again, this is primarily incentivizing health plans for provider supports, increase in referrals, and again, making sure that people are connected to both physical and behavioral health care. And then finally is the increase in shelter beds. We have two major projects going on, and I did edit this, Karen, so I apologize, for the capital operational support for the Corona Navigation Center, and then also the increased investment in the Palm Springs Navigation Center. Two key navigation centers that are providing not only shelter beds, but full wraparound services and actually permanent units and transitional units as well. Next slide, David. So just kind of a recap, the really key takeaways is the ability to leverage investments for sustainability. You've heard me talk about this, as we've been very blessed over the last couple of years with CARES Act dollars, ESG, ARPA dollars, but we all know those are coming to an end. We also have heard that there'll be about a $25 billion deficit, hoping that doesn't happen. So we're worried about the sustainability of funding from both the federal and state level. We will keep advocating for dollars, but what this shows is that we've been able to find a way, and again, thanks to the cooperation of IEHP and Molina, to continue some sustainability going forward. Again, that's a lot of the reason too that we invested in current and ongoing projects. You can see this is also through $35 million, a significant investment in capital and human infrastructure. We wanted to make sure we were funding both capital improvements, but also, again, the human capacity and building within our partners. Another example of a great public-private partnership. This is the wave of the future when it comes to homelessness and housing. Most of you know that through the Housing First model, it's far more labor intensive, requires a lot more engagement through our staff, not only within the county, in HWS, RUHS, behavioral health, adult protective services, I can go on and on, DPSS, but more importantly for you as partners, and the amount of capacity that you've had to increase. So again, continue to look for these public-private partnerships, and that includes works with our cities, such as the Murrieta, Corona-Norco Partnership, the Coachella Valley Association of Governments, and others. As I said, it's data and results driven, aligning with the metrics and goals within our strategic plan. The state is finalizing the metrics and data requirements for the health plans, and that'll be out in January. Again, we're very confident that those metrics will be approached. And then again, back to the integrated service approach. We know that, again, this is about the no wrong door approach, but more importantly, how we are working cross-sector through county departments, our service providers, our cities, our businesses, to make sure that we're solving this problem in a holistic approach. With that, I am happy to take any questions. Again, Karen, I appreciate you moving me up on the agenda.
I see in the chat that Councilmember Edwards has a question about metrics.
Yeah, and that's kind of what I've addressed at the end there, Councilmember Edwards, is we're waiting on the state to finalize what their metrics is. What we're hearing is that basically you set a baseline of homelessness individuals within the health plan system. IEHP uses a very, very liberal definition of homelessness, and so that's the reason we're aligning it with the PIT count this year. And the state wants them to align with the county's statistics, which all of you know is the PIT count. And so we'll get a good denominator on that. But the state looks like they're looking for about a 5% increase in the number of people housed. So if you just take what IEHP says they housed last year, which was 8 individuals, we're pretty confident we're going to meet that 5% housing within a day. So, again, over the year. But again, and Councilmember Edwards too, is once those metrics come out, we'll give everyone an update on those as well.
I don't see any more questions from folks. But I did want to, just for the benefit of everybody that is participating in this meeting, I would really like to acknowledge Tanya and Greg. They spent countless, actually, I think even Heidi also participated in these meetings, countless hours working with IEHP and Molina and collaborating to look at all of the details in our homeless action plan, look at the capacity across the region, and work so hard to try to pull something together so that both IHP and Molina would meet the deadline for submission and approval of the plans. And so we're very fortunate to have such great staff that are so knowledgeable. And I think even trustworthy too, just the relationship that they have with the two health plans. From what I've heard, we're moving along like at light speed compared to some of the other counties. And that has a lot to do when you have people of integrity and there's trust relationships and they're working together to try to do the right thing. So go Riverside County. So good job to you guys.
Madam Chair, if I can answer, Councilmember Edwards had a couple more questions. And the application process was primarily through the health plans in the state. So the state puts out the guidelines for the health plans. So the health plans work with the Continuum of Cares to develop the investment plan, which they submitted September 30th, I believe was the date. This doesn't go through a traditional RFP process because it's the incentive program type, so it's not really a grant program. And again, because of the type timeline, that's why we worked with the health plans to secure or to establish the funding buckets around current programming and capital investments, again, to leverage the dollars and to make sure that there were sustainable amounts on that. And so we've already pretty much contract with our current partners that we utilize. Many are on this call that provide, whether it's the outreach services, the healthcare services, the housing services. So many of the partners that we already utilize through our CoC funding, as well as, HAP funding, HEAP funding, cash will be included.
Looks like Linda has a question, Greg.
And Linda, I'm not sure IPP.
Some kind of an individual something plan, maybe? I don't know. Linda, are you on?
Yeah. Can you hear me?
Yes.
Yeah.
Okay. It's the invest plan. That's what IHP calls the investment plan, which is a pot of money that's designated for the infrastructure and the development of the entities within IHP and Molina. So it's that kind of pot of money with their time parameters. Is that what you're saying? Okay, gotcha.
Correct. And so, and the incentive activities within.
Right, and that's what that I is.
Yeah. And so, and the state outlined specifically what activities would be incentivized. And so that's why Tanya and I aligned our programming with those so that we meet it.
So I went in and I saw what the county wrote and I saw what IHP wrote to the state in their plans. So it's available. If people want to look at it, it's there. I can probably dig it up and just send the link to Karen if she chooses to send it out. But it's all very interesting. Thank you, Greg.
You're welcome, Linda.
Very nice. It looks like you have another question from Councilmember Edwards, Greg, about the permanent supportive housing.
So right now, the housing dollars will be, we're actually, Mike and his team are working on presenting a list to IEHP and Molina on the projects that they will fund. But it's existing developers that the county has already probably invested either direct allocations out of our housing fund or through project-based vouchers. Obviously housing projects that have done tax credits, but as you all know on this call, even those funding streams, and of course the city of Riverside knows better than anybody, is the gap funding needs and all that. So that's what we're looking to do, is fill those so that, again, developers aren't burdened with high interest loans and can actually get projects online quicker.
So if we had recommendations while that list is being created, who would we talk to?
Send those to me, Aaron. I think you have my email, but if not, I'll throw it in the chat. But
that'd be great to see it in the chat. Thanks.
Okay, anybody else?
Ayako from Mary Erickson here.
Yes, please, go ahead.
Hi, Karen. Great to see you.
Good to
Thank
see
you,
you
Greg,
too.
for that wonderful presentation. Yes, and one of the things, again, Ayako Utsumi with Mary Erickson Community Housing, an affordable housing developer. One of the things we struggle most with is density. In order to qualify for all these funding sources that are out there, we need very high densities and the publicly owned land that's free, and that lends itself to a very lengthy, pre-development process. Publicly owned land works because, they're willing to wait. It's free, or at least at a low cost. But so many jurisdictions are not interested in increasing density, and therefore we won't qualify for any of the housing funds. What could the CoC do to write a policy statement or some kind of encouragement to the jurisdictions to say, hey, what can we do? How can we facilitate upgrading the zoning density? There's SB 682, no, excuse me, AB Assembly Bill 682, which is an increase in density bonuses law that's was passed in September, will go into effect in July of next year. What are some of the things that we could do as a collection of community organizations to really encourage jurisdictions to not be afraid of density? So that we can build this housing that we just talked about.
I'll start, and then Greg, I'm gonna maybe have you comment too. So I know it's a great question, and we always want to do what we absolutely can to come together as a region to give feedback about policy. I know that when all of the housing elements were in the process of being developed, our policy advocacy committee looked at opportunities to encourage certain strategies within the housing element to be able to facilitate the development of more affordable housing. So sometimes it's timing with respect to when local cities are looking at land use opportunities and making land available for affordable housing to comply with state requirements for RHNA numbers. Then there's also opportunities on the legislative side, and Greg is the lead person for our policy advocacy legislative and Housing Resources Committee. So Greg, I don't know if you have any suggestions, because I know that you do a lot of work in the committee with some of the others.
Yeah, and I think to the point of watching legislation that comes forward that will support on density issues, on treating regions like ours, I'm going to say in an equitable way, but really because we're unique as the fastest growing county in the state, second fastest in the nation. To your point, we don't qualify a lot on density bonus issues. We don't qualify for climate issues around funding, even rural designations. I mean, I would argue we have some very rural areas, especially in western part or eastern parts of the county, but don't qualify under rural designation, as well as transportation hubs. Riverside really is the only city that has a decent transportation system in the county. So we don't. So I think to your point, it's really watching legislation. Karen makes a great point. A lot of these decisions are based on local. And so is really engaging, utilizing resident engagement at the planning commission step, as well as the city council, engaging political will, such as Councilwoman Edwards that's on the call, to be the advocates and champions of density, as well as ADU siting, as by right siting, and all that. So it's an ongoing thing. And Ayoko, we basically really started a year and a half ago around really delving more into policy and advocacy. And so we'll continue that. The county is finalizing their legislative platform, and it's very heavily emphasized on housing and reforms to that. So, and we're already meeting Carolina, who is the top legislative affairs director for the county, and I work very closely together. We're already meeting with new Assembly and Senate people that were elected, as well as current ones, to further those plans as we move forward. And what we'll do is, and I usually in the CoC, and I'm not going to do it today because I have to hop off to another meeting, but I usually do a housing update. There's not a lot to update this one, but that's where I tended to highlight some of the legislative stuff that's going on. And we know we'll see a lot this year as well.
Yes, it'd be great to have like support letters or letters of encouragement that we can take as developers to our respective jurisdictions and say, look, the county CoC is supporting this, just something for more encouragement, for some kind of official documentation to encourage.
Yeah, and what I've tried to do, and I think many of you who are on the CoC distribution list probably got the email that we sent out, for the federal advocacy around tax credits and that. So I encourage you, I know you get a lot of emails, but when you get those advocacy emails, we only send out ones that we feel are going to be really effective because they're not going to inundate you. But it's to click on that link. Most of them are very easy to do because it's one thing for us as a department or CoC as a whole to do it. But if we're getting individual partner organizations enhancing those efforts, it really does. It's really a powerful message. And what it's doing too is we're actually elevating Riverside County's voice, not only in the state, but nationally. And they're realizing the good stuff we're doing. Do we have challenges? Of course. But if we don't communicate those challenges and those stories to our state and federal partners, then we're not going to get the resources that we're entitled to and that we deserve.
Correct. Thank you very much for your leadership.
And I do have to hop off. Thanks, everybody, and happy holidays to you all.
Thank you so much, Greg. Okay, we're going to go back in order. We're going to move back up to old business. So David, if you could pull up the slide, we're going to talk about, go ahead and move to the next slide on the results of the Board of Governance election. So we can see the beautiful faces of the amazing leaders that have been elected to the Board of Governance. And for those that are on, I know Councilmember Edwards is on. Would you like to say a few words about this exciting opportunity that you're going to be, you are on the Board of Governance now. So the floor is yours.
Thank you. I will just say thank you. I'm so grateful to be on the board and to be able to continue to work to support housing and homelessness and the amazing work that you all do. I was thrilled to hear the news. I couldn't be at the meeting because we just had a baby. You can see his little head poking out here. So baby Simon's been listening to all your work, is very inspired, and can't wait to roll up my sleeves and dig right in.
Congratulations. Going to be a great asset to the Board of Governance. And baby is always welcome to all meetings.
I'll let him know. Thank you.
Dr. Charles Lee Johnson from Cal Baptist also is a new member of the Board of Governance. Are you on with us? I'm looking. I don't know if I see you on. And then Jasmine de la Trinidad, formerly homeless youth. Are you with us today? I know that at the Board of Governance meeting, the folks had an opportunity to say a few words. I don't think that she is with us, and I don't believe that he is either, but super excited about the election results. So great way to end the year with adding experts to important body that makes critical decisions for the continuum of care. So let's go ahead and move on to item 5.2, which is an update on the homeless point in time count. And it looks like we have Miss Emma with us. Hello, Emma.
Hello, everyone. Thank you so much for being here today. Thank you to our chair, Karen, for always doing such a great job in leading our meetings. Go ahead and move on to the next slide, Josh. Oh, okay. I think the point in time count slides were included in the CoC update, but that is okay. So our point in time. Okay, thank you. And I'll just go ahead and jump in as he's doing that. So our general point in time count is going to be January the 25th of 2023. Next year, which is just a little bit over a month away. Our next community planning meeting is January 5th from 3 to 4. And I'd like to encourage all of you to join that meeting. It is so important that we have participation from across the county. We need everyone to get involved so that we can get as robust of a count as possible in every single one of our jurisdictions within Riverside County. We have had some community planning sessions, so if you can't make the next one and you'd like to access previous recording and information, we do have all of that available in our community planning Google Drive link, which was made available inclusive in all of the CoC meeting documents. So you can go ahead and reference that to get that information. Also wanted to highlight that we have a required volunteer training that is scheduled for early 2023, and all of our volunteer links are live. So please sign up, morethanacount.org. We've made it really easy for you this year. We have one form to fill out. Try to streamline it as best as possible. So please sign up. Please encourage your staff to sign up, encourage your neighbors to sign up, your family. We need as many people as possible to participate. For our city leads, wanted to update you. We have incentives that will be distributed in early 2023. So we want to make sure that as you are communicating with Laura Gonzalez, who is our PIT count coordinator, that you are communicating how many incentives you need. We have been sending out emails to our city leads. So if you haven't seen an email, please go back and look through your email. The emails have been going out in the last couple of weeks. If you didn't receive an email, please reach out to us. There is information that we need from you. We need to know who your law enforcement or outreach team contact is going to be, where your deployment site is going to be, the number of volunteers you will need, and also, as I mentioned, the incentives you will need, because we internally require a little bit of time to get all of that coordinated and to make sure that we get that to you prior to the actual day of the count. Also, as we have up here, we have our youth point in time count. That is going to be over 3 days, so the 25th through the 27th in the afternoon. We need volunteer participation. If you are available to participate in the afternoons, please consider joining us. Last year, we had a little bit of a challenge with our volunteers in the afternoon for the youth pick count. And so we want to make sure that we have plenty of people registered. Again, you can register at morethanacount.org, or if you have your cell phone, you can scan the QR code with your camera on your phone, and it'll take you directly to the registration site. And next but not least, we have our Come and Be Connected events that we are looking for vendors who serve youth to participate. These events are really important. The goal of them is really to be a resource fair and to survey youth about their current housing status as part of the youth point in time count. So this is an extension of that, and to connect youth experiencing housing instability or who are couch surfing to community resources. So it is vital to connect these youth to community resources in order to prevent them from entering homelessness. And the vision for these events is to survey those that are 18 to 24, and again, identifying any services that we can connect them to immediately. Our events last year were very well attended by our community partners, and we would like you to participate again this year. So if you are able to participate, please contact us directly. And also, we need your support in promoting these events. We do have all the flyers available for you, and we can get our media kits sent directly to you. Just contact our office and we will get you all set up. And Madam Chair, would you like me to go over the rest of the updates, or would you like me to wait until the CoC updates?
You can go ahead. It's totally fine. Jump right ahead.
Okay, so I wanted to just mention we have our longest night event, Homeless Persons Memorial Day this evening from 5 to 6. We will be hosting in partnership with the Department of Behavioral Health, 2 events, one in Riverside at Fairmont Park and one in Hemet at the Behavioral Mental Health Clinic on State Street. The addresses are listed on the bottom portion of each of these flyers. So if you are available to join, we would love to have you there tonight. It's going to be a beautiful event. We're going to have a candlelight vigil for these individuals. We have over 200 individuals who perished on the streets of Riverside County this year. So we would like to commemorate them and bring awareness to the issue of homelessness in our county. We will also have outreach teams available, and we'll be distributing incentives, and we'll have a meal available to any of our unhoused neighbors that participate during the event. So it's going to be a really great event, and I really hope to see you there. My only other update was that we received votes for our official new CoC logo, so we are very excited about it. This is the logo that was selected by all of you, and so you will start to see this new branding across all of our forms on our website and any correspondence that goes out from the CoC. So thank you very much for participating in that voting. We are very excited about it, and thank you to David, who helped actually design this logo. So kudos to him, and thank you so much, everyone.
Good job. Okay, so I think we now should be at agenda item 6.1. I think it's Roshana. I think you're going to give us an update on HAP and EFSP. Take it away.
Thank you, Madam Chair. Good morning, everyone. Roshana Walker here, Senior Program Specialist with the Continuum of Care. And I am happy to announce that we have released an invitation to bid last Thursday, I believe it was the 15th, for our HAP and CASH programs. And it's about $1.1 million, which 441,000 of that is for youth specific rental assistance and rapid rehousing programs. So it's for any organization wishing to support rapid rehousing and rental assistance for our homeless and at-risk families here in Riverside County. There will be a non-mandatory bidders conference in January, which I believe is January 5th. All of the information, and I'm going to put it in the chat, all of the information is located on our website, as well as I'm hitting the link on in the chat. So I'll put my email information in the chat as well. If you have any questions or comments, please reach out to me. Also, too, we haven't released it yet, but keep an eye out for our EFSP, our Emergency Food and Shelter Program. Our Phase 40 will be released in mid to late January of 2023. So keep an eye out for our Emergency Food and Shelter request for applications as well. And that was all of the information that I was presenting today. Thank you, Karen.
You're very welcome. Nice job. Does anybody have any comments or questions? Okay. Let's see. We are at agenda item 6.3, permanent supportive housing, data summary and recommendations. Says Joe Coletti. Is Joe going to do that, or is county staff handling that? Emma, are you taking this?
Yes, I'm taking it. Thank you.
Okay.
You can go ahead and go to the next slide. Thank you so much, Josh and David. Before you hear, I just wanted to highlight a few things and also let you know that we have gotten permission from Joe Coletti, who is our CoC consultant, to share his report with all of you. He actually did a really nice presentation to the Board of Governance and went into quite a bit of detail about the report. The recording is available on our website if you'd like to see it. Additionally, and I just want to preempt the conversation with this, if you have questions regarding the report, I ask that you please contact us by email so that we can provide them to you after the meeting. So just to highlight a few things from his report, we did have a total number of permanent supportive housing beds that increased by 40% since 2019. So we have increased our permanent supportive housing beds by approximately 300, which is outstanding. We also have nearly 500 permanent supportive housing units that are going to be created during the next few years, which represents an increase of 50%. Also, outstanding work by our community housing and development team. They've been working very hard. Additionally, the Department of Behavioral Health has been working very hard to develop these units. And so it's really been a team effort across the county with multiple partners that has been able to realize these permanent supportive housing units. Also worth noting is that we have 300 permanent supportive housing units, which will be created during the next few years because of No Place Like Home awards. So we just wanted to highlight a few of those stats for you. And again, the full report is available for you on our Google Drive. And if you have any questions, please feel free to contact us at coc@rivco.org, and we'll be happy to provide you with that information. So thank you very much.
Nice job, Emma. Does anybody have any questions? I know when during the Board of Governance meeting when this was being presented, you guys couldn't see, but I was doing like triple flips. I was like so absolutely amazed at the phenomenal amount of progress. This is monumental. And, you know, I don't think that Mike Walsh is on, but to Mike and his team, he has like Jedi magic. If you've ever worked with that guy, I mean, affordable housing deals are complicated. Michelle's laughing because she knows like the deals when you have to try to cobble together tax credit financing, multiple different sources of federal and state financing, and sometimes even conventional financing and project-based. It is a science, and you know, him and his team make it look easy, and also they work so well. We're so fortunate because they're all within the same department. That's why it was so smart that the Board of Supervisors configured HWS the way that they did, because they collaborate so closely with the HWS staff. So when we were on the call for the Board of Governance meeting, I asked Joe Coletti how we stacked up to other counties, and he's a little bit shy about it because he works for multiple counties. So I think he wanted to not, but he alluded to the fact that we are absolutely shining stars when it comes to the amount of leveraging and production that is going on in this county. So I hope you all will take a moment just to celebrate on what has been presented to you and what is happening, because I think a lot of times we're just dealing with so many people in crisis and feeling like there's not enough housing, but there is a ton that's in the pipeline and a lot of progress that has been made. So we all need to remember to celebrate the successes. So this is a moment for that. And that is truly my update on agenda item 7.1, because Greg covered the HIP overview and Emma covered the PSH data summary. And that really was, besides the election results, that was everything that took place at the Board of Governance. So that's all I have, except to say, wow, I'm just in awe of the progress that we're making. So with that, we're going to go ahead and go to the next agenda item 7.2, which is the CoC HMIS lead agency update. And again, we have the wonderful Emma. Take it away.
Yes, thank you very much. Go ahead and advance to the next slide. Do we have the HMIS? No. All right, that's okay. David, if you don't have the slides, I can just verbalize what we were going to present here. So our HMIS team is requesting that all ESGCB subrecipients enter their client data before the Q4 ESGCB reporting cycle. So we have to submit our report to the state by January 17th of 2023. So we just want to remind everyone that your data needs to be entered prior to that. And if you have any questions or concerns, please feel free to reach out to our HMIS team, hmis@rivco.org. They can help work you through any issues that you're having within Clarity, but we do ask that you not wait till the last minute, and please get that in a timely manner, because we need to make sure that our staff has the opportunity to gather the data and put everything together. So please, 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 our Christmas wish is that you enter your information as quickly as possible. On the next slide, you'll be able to see the HMIS team's contact information there. You can also contact Gordon directly. He is always happy to assist. And thank you for all of your efforts. And again, thank you ahead of time for entering your data in a timely manner. And those are all the updates I have for everyone today. Thank you.
All right, then. Any questions or comments before we move to the next agenda item? Hearing and seeing none. We're going to go to agenda item 7.3, coordinated entry system lead update. We have our Myrelle here. There she is. Hello, Myrelle. Take it away, my dear.
Good almost afternoon, everyone. My name is Myrelle Cavazon. I am the CES coordinator here with the Behavioral Health Home Connect program. I do just have a few updates today, and then of course our monthly CES lead update report. I do have it up and open and ready to share if it wasn't added to the presentation. I'm going to go ahead.
Go ahead and share them now.
Okay, cool. I wasn't sure. Okay, let me go ahead and share my screen really quickly. Okay, so there are some changes this month. As you can see, right off the bat, we are still missing the number of calls for the months of October and November. Our administrative services supervisor is working with the IT department to still try to be able to access this data. It has been challenging. However, we will continue to work with our IT team so we can obtain access again to not only be able to present the data, but also update the reports that are missing this data and go ahead and reshare them with you all. The data this month has been specifically pulled from Clarity, utilizing the reports. There are significant changes in comparison to last month's report that I do want to go ahead and address. Starting with the VI SPDATs received, there is a significant increase in the assessments received for adults and a drop in the T assessments. I have found that, and I also did go ahead and mention this in the CES Community Partnership meeting if you were in attendance. There were about maybe 10 to 12 single adult VI SPDATs that were actually identified TA'aged youth. So I did want to go ahead and mention this here as well. Since the assessments were completed on the single adult assessments, we did go ahead and add those to that row there. And they have been accounted for in that area. We will continue to monitor this and help train staff and community partners and agencies to utilize the correct assessments for the targeted populations. There has also been a drop in the data as well as the overall number on the breakdown of consumer by city. I believe last month it stated somewhere in the thousands. This month is reflecting 727. I have found when working with Clarity that there have been many clients who are enrolled in the CES program in Clarity and have completed assessments, but have not been referred to the community queue, meaning that they are not on the active by name list. Home Connect does continue to see poor data entry into Clarity, and we do need all of your assistance in working together so we can go ahead and help improve our data reporting and all that good stuff that has to do with Clarity. Before moving on to our just brief CES updates, are there any questions regarding the data that is being presented at this time? Okay, don't hear any. So as for updates, Home Connect has been working and supporting staff and community partners and agencies with the Clarity transition. In lieu of a more formal Clarity focused training, we have been training and answering many questions that staff may have during our CES community partnership meeting. We do hope to be able to create a more Clarity focused training and or possibly training modules that do cover each specific data entry step that has to do with Clarity in the very near distant future to ensure that all staff is knowledgeable and comfortable navigating through and using Clarity to its fullest extent. Home Connect staff have been working solely with Clarity and the queue to match clients to housing vacancies. There are agencies that have been alerting Home Connect of housing vacancies to through Clarity as well, and that is very exciting to see. Home Connect staff are working diligently as they are also learning Clarity themselves to send referrals for referral requests received, such as projects like Vista Dorada, Cathedral Palms, Veterans Village of Cathedral City, and Mission Heritage. The last update I do have regarding a change, I'm not sure if I mentioned this last meeting, but there has been a change regarding the Home Connect prioritization requests. The prioritization requests are now being reviewed by a review council that does consist of our leadership team. Our leadership team does consult on these prioritization requests that are received as a team basis. And if there is further follow-up that is needed regarding the determination that the leadership team, the review council came to, they do offer case conferencing. They do go ahead and connect with agencies who do submit these prioritization requests and would like additional information. So that has been a pretty big change in my opinion when it does come to CES. But that does bring me to the end of our CES updates. Before passing it over to our lovely Madam Chair, are there any questions for me?
Okay, hearing none. I see Angelica and Christopher, and I know you are on. I'm not sure if I'm missing some of the others from the team, but having had the privilege of working with you guys for the past couple of months on a HomeKey project, which they have very specific deadlines for how quickly construction needs to be completed and lease up needs to happen. And knowing that there's multiple projects across the county, I just want to give you guys a shout out and a cheer. And John Horn, he's, I think, part of the team too. I'm sure I'm missing folks on your team that are working so diligently with CityNet on coordinating the VI SPDATs and the disability verifications and the special housing authority form that you need for project-based vouchers and the collaboration with the housing authority staff. There's so much that goes on behind the scenes. And when you think about the update that we just heard about with all of the development of new housing units, we know you guys going to have a lot of customers and a lot of work to get people housed. And a lot of times your work is behind the scenes, but I want you all to know in the coordinated entry system team how much we appreciate the amazing work that you guys do every day.
Thank you so much, Karen.
Okay, let's see. I know Greg said that he already covered his update. You can see in the Google Docs looks like you've got 3 different reports to read, exciting reports of things that are happening in the different standing committees of Continuum of Care. Also, you will see that we had multiple opportunities. Myself and your lovely vice chair had the privilege of signing 3 different letters of support, Faith in Action, QueerWorks, and US Vets. So we were very excited to sign those letters of support. Also, you'll see annual performance reports for 2 different nonprofits or projects in the Google Docs. So at this time, I can open it up to see if there is a call for agenda items for our next meeting, which remind me, February, what was it, David? 22nd? Oh, it's probably right on there. And
Yes, ma'am. February 22nd. Yeah.
That's right in front of my face. So, okay. Does anybody have any requests or suggestions for our February meeting? Okay. Any announcements? This is your opportunity, everybody. There's a lot of super cool work going on out there. Is there anybody that would like to make an announcement of some pretty exciting stuff that has been happening across the region? Okay. Well, I will make an announcement. Oh, Jacob, please take it away, Jacob. Love to hear from you.
Hi, me always. Sorry. Took me a second to find the hand raise button. So I mentioned, I don't remember, it was last week that we did a gift card giveaway, and we were able to give 50 participants $100 gift cards, and then I was gonna run some numbers. So I have all that data collected. I'm gonna email it to David, and then David can send it out. But we got some pretty, it's community-based survey, right? So it's not like IRB data, but it's still important data. So I just wanted to let you all know, if you get an email from David with data, that's a little bit more background of where it's coming from. So, and all the gift cards went out, everyone has them. And we've had some emails from people saying they're able to buy, a couple of things for their families or feed themselves for the holidays. So, yeah, pretty excited about that. So, and happy holidays, everyone. Thank you for always having such amazing things to teach me when I'm always on these meetings. So thank you.
I got you. Thank you so much for all the great work that you guys do. Okay, so let's see.
Karen, in the chat, we have last name Jones who would like to make an announcement.
Oh, thank you for catching that for me, David. Okay, Kenesha.
Hi, good morning. Sorry, I couldn't find, I'm driving, so I couldn't find the button to raise my hand, but I just wanted to announce that our organization has officially acquired the location for our Bridge Youth Wellness Center in Moreno Valley. So we closed escrow on that on November 30th, and we're super excited about it. And so just wanted to share that with you, you guys. We're hoping for end of February, March opening to the public. There's a lot of different moving parts, of course, as you can imagine. And we also, another announcement in relation to that, we're recruiting for a clinical director position for that location. And I will put the link to the job announcement in the chat, and hopefully if you guys have any referrals, send them that information. And it's a really good time. I think it's exciting time to be a clinical director with us, to bring on board our new programs and services. So thank you.
Nice, that's great.
Kenesha, if you'd like to send the job posting to us at coc@rivco.org, we can send it out to our listserv of all of the partner agencies that are part of the CoC for you.
Awesome, thank you. I'll do that.
Anybody else? Don't be shy. Well, before we close out, I made this announcement at the Board of Governance, so a lot of you were on that meeting, but for those of you that were not, I wanted to share that on December the 7th at our City Council meeting, our City Council approved a $4 million contract with Mercy House to operate our 40-bed shelter, which is 30 beds for males, 5 for females, and 5 post-hospital recuperative care beds. The contract also includes 12 units of permanent supportive housing, $1.1 million in tenant-based rental assistance, as well as a transportation shuttle program to provide meal services and other supportive services at our navigation center. And we are going to be working with Mercy House over the next couple of months. There's, I think, probably between all of those different programs, 50 plus different positions that have to be hired, because the Shelter Navigation Center is 24/7. So you have to have folks at different shifts. So a lot is going to be happening. And when the time is right, we will be having a grand opening ceremony. And I hope that you will come and join us in the joy of bringing more resources to this region. So I'm just truly grateful. And if any of you have ever attended city council meetings or board of supervisors meetings where you see folks where there's NIMBY because of fear and misunderstanding of the value that shelter and housing brings, a lot of times that say not in my backyard. There were 19, I think maybe even more than that, speakers for that particular agenda item, all in support. We did not have anybody from the business community, the regular community, or otherwise that spoke against it. It was beautiful between businesses and the faith community and residents and advocates and county agencies, even Supervisor Spiegel. It was a magical night. That's the only way that I can describe it. So I'm happy to share that announcement with you guys. And just want to say what a privilege and an honor it is to work with all of you. I look up to all of you so much with all of the knowledge and the hard work that you bring to this region. I look forward to the amazing things that we're going to do in 2023. I feel that it's going to be a phenomenal year. I wish all of you, you and your family and friends, a beautiful, blessed, happy holidays and an exciting new year. So that concludes our meeting. Thank you.
Thank you, Karen.
Thank you, everybody.